Good day, everybody, and welcome to Dr. Tom's Tips on Tuesdays at 10 with Dr. Thomas Hirsch. My name is Rolando Mia, and we are with Xyrus. So today we've got a pretty cool topic here because it's something that we've been asked about. When you look at it, conscious sedation, oral sedation, sedation. What are some tips that we can hear from Dr. Hirsch regarding utilizing the Isolite in sedated patients? Good morning, Dr. Tom. How are you?
Good morning, Rolando. How you doing today? Hey, everybody. Welcome to Tom's Tips Tuesday at 10. Today, as Rolando said, we're going to talk about working on a sedated patient, be it an orally conscious sedated patient or an IV sedated patient. That's what we're going to tie in today. We're going to talk about utilizing Isolite with a sedated patient. So whenever we have a sedated patient, in my office, we strictly do IV sedation. Whenever we have a sedated patient, we always use the Isolite. One, because it makes my job really easy. But two, and the most important thing, we want to maintain an open airway. So here is the first tip on working with a sedated patient. Make sure your patient is breathing. Highly, highly, highly important. Tip number one. So I have an anesthesiologist that I work with, and he is constantly monitoring the procedure, monitoring the patient's breathing. I will get instructions from him that I listen to when he says, lift the chin up, tip the head back, open the airway. Highly, highly important. Okay, so that's the first tip of the day. Bringing that right back around to utilizing the Isolite. We have one here. With the Isolite and with a sedated patient, be it orally sedated or IV sedation, I always pick an Isolite that's maybe a little bigger than what I need because I want to maintain and make sure that I have a good peripheral seal. I don't want to see any leaks of any kind, any open area of any kind, any spot where any water can go down. So that's another thing. Make sure you have a good peripheral seal. When you look in the mouth and you see a gap between the tissue, you got to fill that gap in with something. So I want this thing waterproof. So my second tip of the day is this. I have a product, and I'm not pitching any product at all here. It's made by Parkel. It is called Blue Moose. We all know what that is. It's a bite registration paste. It's relatively inexpensive. I like the super fast Blue Moose because it sets in 30 seconds. So anywhere that I see a gap, up on the palatal vault, I'll seal that in. The floor of the mouth, I'll seal that in. Back on the retromolar pad where this wraps around, I'll seal that in. On the buccal vestibule, if there's a gap, I'll seal that in. Anywhere there could be a possible gap where any fluid could possibly go by there, I will seal that in. That's the second tip of the day. Now, I've been also asked, do I use a throat pack? Sometimes I do, and sometimes I don't. With an orally conscious sedated patient, which I don't do in the office, by the way, I don't know if you're able to use a throat pack there or not. With my IV sedated patients, I almost routinely use a throat pack. Why? It's just an added little barrier, just a little added insurance that just in case some water goes by, we're going to suck it up. Just in case. Water usually doesn't go by, but, you know, it has a, if something can go wrong and something goes south, it probably will. So make sure that you do everything that you can to protect that patient. So that's tip number two is the Blue Moose. A throat pack is necessary, may be necessary, and you may use that also. The nice thing about utilizing Isolite with a sedated patient is first of all, it keeps the patient's mouth open. That's really huge. Whether you're doing a surgical procedure, an implant procedure, or you're doing a restorative procedure, you certainly can utilize this for isolation.
So Dr. Tom, real quick, sorry. In placing it inside the mouth, especially with IV sedated patients, I believe there's more suction or evacuation depending on the kind of how you orient the head. What is that about?
Okay, so with the Isolite, we sit down there and, you know, we have peripheral. Oh, you like this one? I drew a squishy fish on here for sure. Right. One of the pediatric dentists. So with the Isolite, you know, we'll sit down there and we get aspiration throughout the whole perimeter of this whole thing. It'll evacuate through there. And also through the back end of the bite block over here, we're also getting evacuation there too. So oftentimes, let's say I'm working on the left side of the mouth like this, I will actually have the patient tip their head to the right, so the fluid will flow to the lowest spot. And if it's going to be any pooling of water at all, it'll evacuate through the back end of the bite block. That's a real good point that you bring up. So we'll position the patient from side to side, and we actually carefully will tip their head to the right or to the left as necessary if we happen to see any fluid or water. The nice thing about the clear Isolite is you can actually see through it, and you can see if there's any pooling going on behind that.
Excellent. And then what tips do you have for doctors with regard to the patient's tongue? Because, you know, depending on the, I think it's the angle or how far back you put them. And are there any tips with regard to it, especially for IV sedated patients and it flopping back into the airway?
Are you talking about you said the patient's tongue?
Yes. Yes.
Okay. The tip on the patient's tongue is this: you don't have any control of the patient's tongue when you've got the Isolite in the mouth. So once again, I listen to my anesthesiologist. He'll be able to hear the breathing. The patient's, just lost my train of thought.
Patient's tongue, and
no, hang on for a second. The patient's tongue is going to go back anyway, and it will flop back. Oh, here we go. So always keep the chin elevated as much as possible. And the anesthesiologist will tell you, elevate the chin. And if you're elevating the chin like that, and sometimes your assistant may have to elevate the chin throughout the entire procedure when you're working on this, just to maintain an airway. So if the patient's tongue head is tipped back like that and you elevated the chin, that seems to open up the airway too.
Awesome. Awesome. And then any final tips with regard to, you know, if you look at it in a sedated patient, how big a mouthpiece can you place inside sedated patients?
You know what? I put the biggest dang mouthpiece in there I can possibly get in. Because I want working room. With a sedated patient, sometimes they will close down. If you don't have something in their mouth, they're going to close, and you're drilling, they're going to close down on that drill, and you are just up the creek without a paddle, I got to tell you. So you want to make sure they're not going to bite down on anything, be it a bite block where there's some people just use bite blocks, which really doesn't serve a whole lot of purpose other than to open up the mouth and keep them from closing. But that does nothing for the fluid and the volume and the tongue and the protection. So you definitely want all these areas protected. Now, the last thing you want to do is work on a patient after the whole procedure is done. You beat up their tongue, you cut their tongue or their cheek or their lips. So, protect everything. That's why I love the Isolite for IV sedation or oral conscious sedation.
So this is cool. So if I understand correctly, whether it's orally conscious, oral conscious sedation or IV sedation, Isolite works really well. Keeps the mouth open, helps in evacuating. Yeah. And you can see through it. I think number two, and I like the tip you gave with regard to, there are other products that you can have in the event that you have a gap that you can seal it. So you can use those, and you showed one of them, which is a blue mousse type of thing that cures really quickly. A third thing is tilt the way you tilt the head, if I understand correctly. Make sure that you're tilting it towards the bite block because it's evacuating through there, which is pretty cool. Tip 4, you can put a bigger mouth.
Yep. Tip 4, you can larger size mouthpiece, and you can adapt that. Even if the mouthpiece has a tendency to flop over onto the palate, that's okay. Let it flop over. But you just want to make sure that you have a seal right back there at the retromolar pad and up in the hamular notch. You want to make sure that thing is going up in there and things are sealed. And the other thing, here's another tip. I get this from my anesthesiologist all the time. He says, reduce your water spray. Turn your water spray down to a minimum so you're not flooding the mouth out. I mean, you just don't want to have a big tsunami going on inside the mouth with water going everywhere. Want to make sure you keep the tooth cool too. So make sure you find that proper balance between too much water and not enough water. It's got to be that nice fine mist, but not a big tsunami flood.
Awesome. And the most important, make sure the airway is open. Yeah.
Make sure your patient is breathing.
Awesome.
You can do a wonderful implant or a wonderful crown or a wonderful bridge. Doesn't matter if they're not breathing at the end of the procedure. So that's tip number 1. Make sure they breathe.
Thank you. Thank you so much, Dr. Hirsch. Really appreciate that, especially now. Lots of things going on. It's great that people are working. Stay safe. Any final closing words here?
Stay safe. Wear your mask. Social distance yourself.
Awesome. Thank you so much, everybody. If you like this content, please share it. If you have any other questions, this is where we're getting them. Please kick them over to us. Let us know. We love to hear any tips that Dr. Tom Hirsch has, and we'll see you again next Tuesday at 10 with Dr. Tom for his tips.
That sounds great. Thanks, Rolando. Thanks, everybody, for listening today. We really appreciate it, and we'll be back next week with another great tip.
Thank you, sir. Appreciate it.